Welcome all for the today's class. So today we continue with the clinical governance module, and the topic for the discussion is a clinical reflective practice. Okay, so what is the concept of clinical reflective practice and why it is important? Okay, so reflection is basically critical analysis of clinical experiences to improve future practice. So what exactly we are doing here? We are doing the critical analysis of a clinical experience, and the purpose is to improve the future practice. Okay, and it is a part of the curriculum also. It is a part of the portfolio of the trainee. Okay, so it is very important. It is required for the revalidation also. So it is a critical analysis of the clinical experiences to improve the future practice. So it is a form of self-learning, self-regulated learning, which involves the cognition, metacognition, and motivation. The cognition involves knowledge and understanding of the particular event. Metacognition is learning how to learn, and third is a motivation, that is willingness to improve. So these are the three things which are involved. So we are critically analyzing one particular event, one from the knowledge and understanding point of view. But beyond that, you go and learn from that particular event, that is learning how to learn. And third is a motivation, that how will you improve on it? How will you work on it in the future? So that is the motivation. These are the three components of the reflection. Okay. So why the reflection is important? Because it is a part of ARCP, the revalidation and ePortfolio. Okay. So it is a mandatory in ARCP, revalidation and ePortfolio. And what are the benefits of this? One, it improves the clinical reasoning. Second, enhances the professional development. Third, it helps learning from the errors. And next is it improves the diagnostic accuracy, especially complex cases. So there are certain complex cases on which, if there is a severe PPH, severe abruption leading to a lot of morbidity, mortality, and you do the reflection on that particular case, you will learn, your clinical reasoning capacity will improve, your professional development, there will be professional development, and we will be minimizing our errors. Okay, so these are the benefits of the reflective practice. Okay, so there is a strong evidence improving the patient outcomes. Is there a strong evidence on from the reflective practice? There is no strong evidence. It's not proven that the patient outcomes will be improved, but it improves the learning and insight. So future mistakes will be, to some extent, definitely will be improved, because this particular reflective practice you need to perform, especially when there is a deviation, when there are some morbidity, mortality related which you are happening. Okay, so when second topic which we are going to discuss, that is the audit, which is going to directly linked with the improving the patient outcome. So here, this reflective practice is not directly linked to the improving the patient outcome. There is no strong evidence, but definitely what does it do? It improves the learning and insight, and maybe indirectly it will improve the patient outcome. Okay, so what are the types of reflection? One, there is a reflection in action, and second is a reflection on the action. Okay, now what is the meaning of reflection in action? That means you are having a reflection when the event is happening. Okay, so you are thinking and critically analyzing the event during the happening of the event. It is a real-time thinking and adjustment. So for example, changing the management based on the evolving CTG. As the CTG is evolving, you are also simultaneously thinking what to do with this particular, whether to go ahead with the conservative management or whether to expedite the delivery, and your whole scenario you are analyzing when it is happening. That is the reflection in action. Second is a reflection on action. It occurs after the event. There is a structured analysis of that particular event. What was the patient presentation? What was the diagnosis? And how the diagnosis was done? Was there any delay? And most used in, that is the reflection on action. This is most used in the portfolios. Okay, generally when there is an event, there is a critical thinking which is done over that particular event in a form of structured analysis. So for example, post cesarean case reflection, you might have encountered some difficult cesarean section, maybe second stage cesarean section. Then why there was a head difficulty? What were the things which you could have done? Which method of head delivery you have used? Whether you could have used some other method, etc., etc. So it is you are performing on the event. The same thing if experienced person may do during the event also. Okay, so reflection in action and reflection of action. Third is the reflection for the action, that is planning for future improvement. Okay, now what is the type of knowledge? Okay, so the knowledge is basically two types. That is the technical rationality, especially when the trainee is in a learning phase. Basically, they are learning the evidence-based knowledge. They are getting the technically oriented. Second is a professional artistry, which comes by the experience. Okay, so it is an experience-based judgment. Okay, knowing in action. Okay, so when a particular event is happening, and simultaneously the experienced person will think and will have the reflection, while technical rationality is the having the evidence-based knowledge. But if there is a minor deviation, if there are 5 criteria, 4 are fulfilled and 1 is not fulfilled, then what to do? The professional artistry will come here. Okay, that is the experience will matter in that particular case. So clinical expertise is actually a combination of both technical rationality plus professional artistry. Okay, now what is the dimension of reflection? This topic, this dimension will not be asked in the examination, but basically it has got a iterative dimension and the vertical dimension. Iterative dimension means it is the experience on which we are performing a reflection, getting the new understanding of the event, and we are changing the future. And what the vertical dimension, it may be superficial or it may be deep. Vertical dimension means we are considering that as a one descriptive event. We are thinking this particular thing has happened, but when that is a superficial or surface level thinking. But if we think in a deeply, if we analyze that particular scenario well, or if we do the critical thinking on it, that is what is expected. That is the vertical dimension. Okay, so it may be superficial, just understanding that particular scenario, but if you go further deep and analyze that and do the critical thinking, that is the deep vertical dimension, and this is what is expected. It is a deep reflection. That is the higher level learning is important, because then we can conclude how to improve in the future. Okay, so often it is difficult and commonly deficient in the ARCP. Okay, so what is expected from this reflection is a deep reflection. Higher level learning is expected, and it is a self-regulated learning. Okay, so what are the models of reflection? Here you just remember certain names. One is a Gibbs reflective cycle, and second one is a Kolb's experiential learning cycle. Okay, so there are two things. One is a Gibbs reflective cycle. It mainly consists with the feelings, emotions, and thoughts. They are taken into account. So Gibbs reflective cycle. Okay, it involves description. What is the event? What were the feelings and thoughts over that particular event? How was the evaluation? Whether it was a good, whether it was a bad event? What was the analysis? Why it has happened? And what is the conclusion? What else could have been done? And what is the action plan for the future strategy? Okay, so there are two models for the reflection. One is a Gibbs reflective cycle, and second one is a Kolb's learning cycle. Okay, so this Gibbs reflective cycle has got certain steps. What was the event? So that is the description of the event. Second is a feeling or the thoughts or the emotions over that particular event. Third, how you have evaluated that event as, whether it was a good or bad. Then what is the analysis, why it has happened, and what is the conclusion, what else could be done, and what is the action plan for the future strategy. This is what is the Gibbs reflective cycle. It takes into account the feelings, thoughts, and emotion. Okay, so it includes the emotional component and it differentiates from other, ends with the action plan. So this Gibbs reflective cycle takes into account the emotional component and it ends with the action plan. While Kolb's experiential learning cycle is, it is the concrete experience. It is a reflective observation. There is an abstract conceptualization and there is active experimentation. Okay, here basically there is a deep learning which is happening. Okay, so Kolb's experiential learning cycle, the steps are concrete experience. There is a reflective observation or that concrete experience. Then there is an abstract conceptualization, that you are going to conclude something from your critical thinking, and then there is an active experimentation in the future. So sort of action plan what was there with the Gibbs reflective cycle. So this is what is the difference between the Gibbs and the Kolb. So this is the reflective observation, a sort of deep reflection is there in the Kolb's exponential cycle. So basically it is a learning cycle, must complete all stages for effective learning, and any single stage alone is missing, then there is no learning. Okay, so any single stage alone is not a learning. So this has to be complete cycle. Okay, so concrete experience should be there. Then there has to be reflective observation. From that observation, there should be abstract conceptualization, and there should be active experimentation. Next is a fish and D Cossart model. Basically, this is a holistic clinical reflection. It includes the context, values, knowledge, skills, judgment, patient relationship. It is used in complex clinical reasoning. Okay. Now, what are the template for written reflection? Now, when there is a reflection, the trainee has to write the reflection. Okay. Now, there should be some template for the writing the reflection. So, basically, the components of the template should be what has happened, what did you learn from it, how will you practice the change, and what will be the future plans, or what will be your SMART goal. Okay. So these are the points in the template. What has happened, that is the description of the event. What did you learn, that will be related to the knowledge, skills, and behavior. Okay. And how will you practice change, what were the strengths, what was the gap, what is the behavior change that is expected, and then you will have your future plan in form of SMART goals. That is, your goal should be specific, measurable, achievable, relevant, and it should be time bound. That is called as SMART goal. Okay, so this is what is the expected in a writing about the reflection. Then this reflection is also linked to the GMC domains, what the trainee are supposed to know. Okay, so it is related to various domains related to the trainee, such as knowledge, skills, and performance. It is also related to the safety and quality domain. It is also related to the communication and teamwork, and it is about the maintaining the trust. Okay, so when you are doing the reflection, you have to maintain the confidentiality also. Okay, so we will see further how to write the reflection and what precautions are to be taken. Now, what are the types of reflection? There may be individual reflection, or there may be group reflection. Okay, so individual reflection deals with the personal and confidential. It may be written, or it may be mental also. Okay, then group reflection. Okay, it is used in clinical incidents, labor ward events, MDT learning. Advantage of the group reflection is that there are multiple perspectives, there is a deeper insight, and there is a team learning. So when you are working in the team, the group reflection on a particular can be individual reflection also. Okay, then role of supervision. Okay, the supervision is very important. When this reflection is there, you should discuss this reflection with the supervisor. Okay, so clinical supervision is important for the facilitated reflection. The key skills are when you are discussing the reflection with the supervisor should listen it carefully, and he should question it. Okay, should also provide the feedback. This is very important, because what is your understanding, there has to be feedback, positive, negative feedback has to be there. Then encouraging the reflection should be encouraged. Self-awareness, reflexivity is very important, and recognizing the trainee's emotions, whether the trainee is under some pressure because the trainee is involved in the particular mishap which has happened. So that also should be taken into account. So recognizing the trainee's emotions and understanding the social context of that, may be related to the stillbirth or whatever event has happened. That is how this there is a role of the supervision in reflective practice. So it is not only the trainee, but the supervisor should also get involved, and there should be some qualities of the supervisor while analyzing this reflection. Okay, so especially what happens when there is a conflict, when the supervisor itself is an assessor, the supervisor is also facilitator and involved in the same event. A particular event has happened, and where the trainee has carried out and followed the instructions of the supervisor, and if the trainee feels that the decision which has been told was wrong, Okay, so there may be little conflict, especially when the supervisor itself is an assessor plus facilitator involved in that particular event. Okay, so these are the practical things sometimes which can happen. Then how the practical reflection process. Okay, there is a stepwise learning cycle, prior knowledge assessment, second experience, clinical event. Okay, what has happened, what was the experience. Then there is a reflection, that is the analysis by the trainee. Then the trainee will compare with the past as well as present, whatever was the past experience and this present experience, why this has happened now. Okay, then the trainee will identify the gap, seek the evidence for these particular incidents, and modify the understanding and will develop the action plan. So this is what is the stepwise learning cycle from the reflection. But there are certain ethical and legal issues with the reflection. Is that one ethical issue is about the confidentiality. Okay, so when we are writing the reflection, we should not include the patient name, date of birth, identifying details. They should not be included in the reflective notes. So reflective notes should not have any identifiable data. Second, there is a little legal risk also, because these reflective notes may be requested by the courts. Okay, so here one should be very careful in writing the reflective notes. The focus should be on the learning and not the detailed case facts. So when you are writing the reflective notes, you have to avoid the confidential information. You should narrate it as an event. Okay, then duty of candor. So we should be very open with the patients if there is a harm. So the reflection should not contain anything patient is unaware of. Okay, so if something is the duty of candor is not performed well or something, that should not be included. So be open with, so always be open with the patients if the harm occurs. So reflection should not contain anything patient is unaware of. So what the patient should be unaware of should not be included in the reflection. Then documentation principle, always the factual details should be taken from the clinical notes, and it should not be the duplication of the clinical notes, but only the factual details relevant to that event we need to take out from the clinical notes. And the reflection, in the reflection you will note down only the learning points from that particular thing. However, there are certain limitations or criticism about the reflection. So reflection may be sometimes forced, or it may be of poor quality. It may be difficult to assess. Okay, so one should learn the skill and must be taught skill. So this should be also be taught. Okay, so from examination point of view, reflection improves the clinical reasoning, insight, and professional development. However, it is not proven that there is a direct improvement in the patient outcome. Okay, so best model for the exam is about the Gibbs cycle, and it takes into account the emotional component also. Then there is a Kolb's learning. It is a cyclical process. Okay, there is a and all components of the Kolb's should be there. Then there is a deep reflection, that is the analytical plus critical synthesis. Then there is a group reflection, best after the critical incident. Okay, and the role of the supervisor is to facilitate and not to just the assess. Okay, so from examination point of view, you should be able to identify the model. If there is an emotional component, it is a Gibbs model. If there is a cyclical learning, it is a Kolb's model. Okay, so best approach after the adverse event is a group reflection plus supervision. Okay, reflection documentation, it should be focusing on the learning, and it should you have to follow the confidentiality rules. So anonymized. Okay. So poor reflection feedback at ARCP. What does it indicate? Lack of depth or the vertical dimension. That also we have seen. It has got vertical dimensions, which may be superficial or deep. So what we expect is the deep understanding of that particular event. Okay. So if there is a poor reflection feedback at ARCP, that denotes the lack of depth. Okay. So that finishes the topic of um, this reflective practice. Okay. So we have few questions, doctor. Can you please go through these questions?
Yes, sir. And ST5 performs an emergency C-section. During surgery, she realizes difficulty in delivering the head and immediately changes the technique based on prior experience. What type of reflection is demonstrated? A, reflection on action, reflection for action, reflection in action. And metacognition, abstract conceptualization. That is reflection in action.
Yes,
Okay.
during the
While
process,
process,
during the,
she
so
is
it is a reflection in action. So occurs during the event, influencing the real-time decisions. So thinking while doing. Okay. So sometimes ARCP they may ask such because we are preparing for the ARCP outcomes, but these particular things we are not taking into account. So there may be some odd question like this. Next.
a trainee writes a reflection describing the event, their emotions, identifies what went well and poorly, and develops an action plan. Which model is being used? A. Kolb's cycle, B. Gibbs reflective cycle, C. Dewey model, Fisher D. Cossart model, Schwann's model. That is B. Gibbs reflective cycle.
It
Because the
they specifically
description,
mention about the
emotions, and
emotions. Okay, it takes into account. Okay. So it will be Gibbs reflective
B.
cycle.
Gibbs reflective
Gibbs
cycle.
reflective cycle. Unique features includes the feelings and ends with the action plan. Okay. Next.
A trainee reflects on a case but only describes what happened without analyzing causes or future improvements. Which level of reflection is this? A. Deep reflection, B. Analytical reflection, C. Surface reflection, D. Critical synthesis, E. Professional artistry. It is C. Surface reflection.
Yes.
Because
It
only
is only
surface
understanding the event. That's all.
description is
Superficial,
given.
this particular understanding. So surface reflection. So descriptive only. Lack analysis and insight. Common reason for poor ARCP outcome. Next.
Following a shoulder dystocia case, the entire labor ward team participates in a structured discussion to explore different perspectives and learning points. What is the most appropriate type of reflection? A. Individual reflection, B. Reflection on action, C. Group reflection, D. Reflective supervision, and E. Schema refinement. It is a reflection on action because it has occurred after the event.
Why not entire labor what team is participating? No, so it should be
Group
group reflection.
group
Okay.
reflection also.
Okay. So it is a group reflection. Critical
But
incident, team-based learning provides multiple perspectives. Okay. So it is will be a group reflection.
okay.
Next.
A trainee progresses through stages, experience, reflection, forming of concepts, and applying in future cases. Which model best describes this? A. Gibbs cycle, B. Kolb's experimental learning, C. Schwann reflection, D. Dewey theory, E. Mann's vertical model. This B. Kolb's learning.
Yes,
It is a
it is a
continuous
learning
process.
cycle. It is a learning cycle. Okay. So there is an experience. On the experience, there is a reflection. Then there is an understanding and some concepts are formed. Okay. And which is applied in the future. So it is a Cobb's experiential learning. Okay. So there are four stages. There is an experience, there is a reflection on the experience. Third, there is a conceptualization, and then you apply. So learning occurs only when the cycle is complete. So all four stages are important. Next.
A reflective entry demonstrates critical analysis, integration of theory, and plans for future practice change. Which dimension of reflection is being demonstrated? A. Iterative dimension, B. Vertical dimension, C. Surface dimension, D. Reflective observation, E. Professional artistry. Sir, it is B. Vertical dimension.
Yeah, it is a deep level vertical dimension. No, vertical dimension. So deep reflection, there is analysis plus synthesis. So higher level thinking expected in senior trainees. Okay, next.
A trainee combines evidence based guidelines with experimental judgment during decision making. Which concept does this represent? A. Reflection on action, B. Technical rationality, C. Professional artistry, D. Reflective observation, E. Abstract conceptualization. It is C. Professional artistry.
Yes, it is because the trainee
Evidence
combines
based
this evidence-based guideline
and
with the explanation.
experimental
So actually,
judgment.
it is a reflection in action which is happening, but at the same time, it is improving the professional artistry of the because of the experience, this particular past experience and the present experience. They are basically here they have mentioned is a combination of B plus C. Okay, best
Okay.
answer will be C, professional artistry. Okay. Technical rationality is one thing for the trainee, but if the senior trainee is there, then definitely it will be professional artistry. Okay, so that is
Yes.
why there is a little confusion. I hope you are understanding this, though there is they have given this will not be in the examination, but you have understood the difference between the two. Okay,
Yes, sir.
so having the knowledge and practicing the knowledge. Okay,
Yes.
next.
A trainee avoids writing detailed case facts in reflection but focuses on learning outcomes. What is the main reason for this approach? A. To improve readability, B. To reduce word count, C. Legal and confidentiality concerns, D. Examiner preference, E. Avoiding emotional bias. It is C. Legal and confidentiality
Yes,
concerns.
legal and confidentiality concerns are there, no? So reflective notes can be requested legally also by the court. They can ask. They must be anonymized and focus on learning and not on the facts as such. They are mainly for the learning notes. Next.
A supervisor facilitates reflection but also assesses the trainee's portfolio. What potential issue may arise? A. Reduced motivation. B. Loss of confidentiality. C. Conflict of roles. D. Inadequate feedback. E. Reduced insight. Is, D. Inadequate feedback.
So that will lead to the
Same as
conflict of roles. No? The supervisor facilitates the reflection, and the same candidate is also assessing the trainee's
assessing the
portfolios. Okay.
conflict of roles.
Conflict of roles. So supervisor, if facilitated plus assessor may inhibit openness, affect quality of reflection. Next.
A trainee reflects on a case and plans to attend CTG training and improve decision making in similar cases. Which stage of Gibbs cycle is this? A. Evaluation. B. Analysis. C. Conclusion. D. Action plan. E. Description. It is D. Action plan.
Yes, he has formed the plan. Okay, future focus improvement, key exam differentiator. Next.
A trainee reflects after a complex case and searches literature to improve understanding. Which stage of reflective learning does this represent? A. Concrete experience. B. Reflective observation. C. Abstract conceptualization. D. Active experimentation. E. Evaluation. C. Abstract conceptualization.
Yes, abstract conceptualization. It involves the theory building plus evidence integration. Next, doctor.
Which of the following statements regarding reflective practice is most accurate? It has a strong evidence improving patient outcome. It is optional in postgraduate training. It is primarily a descriptive process. It enhances learning and professional development. It should include detailed patient identifiers. It is D, it enhances the learning and professional development.
Yes, it enhances the learning and professional, and there is no strong evidence that it improves the patient outcome. Okay, so it enhances the learning and professional development. A key benefit: learning plus insight. It's not proven to directly improve the outcome. Must avoid identifiers and must be analytical and not descriptive. Okay, so from examination point of view, Gibbs cycle involves emotions and action plan. Kolb cycle is a learning cycle. All four components should be there. Deep reflection is the analysis plus change. Then group reflection talks about the critical incidents. Okay, confidentiality, no patient identifiers should be included, and supervisor conflict can be there, which may be asked in the SB. So that finishes the topic of reflective practice, understanding the reflection. Thank you.